Hello, everyone. I'm Dr. Dan Brees, Chief Medical Officer and Vice President for Physician Services for Memorial Health System. I'm joined today by Dr. Tyler Hill, our Medical Director for Emergency and Urgent Care Services for Memorial Health System. We're excited to come to you today to talk a little bit about a new service that we're going to be offering at our Physician Care Express located on Pike Street in front of Walmart in Marietta, Ohio. Last week, we talked a little bit about moving our COVID assessment clinic and drive-through line from our Wayne Street location to our Physician Care Express in Marietta, again on Pike Street in front of Walmart. Dr. Hill will be discussing some of these new services today. Tyler, tell us a little bit about what you're going to be able to offer the community at the Physician Care Express in Marietta.
Yeah. Well, thank you for the introduction. We're very excited to discuss this new opportunity. As you referenced before, our COVID clinic, which was a unique part of our system, which we were able to get up and running very quickly to address the current pandemic and better serve our community during this time, started out at Wayne Street. Now we have relocated it right behind the Marietta Physicians Care Express, which is, again, right in front of Walmart off of Pike Street, a great location. We are going to plan on seeing patients in a drive-through assessment, very similar, almost identical to how they were before. So rest assured, the process itself really won't change very much for those patients. But I think this is a great service for our community during this time.
That's great. So let me ask you a few questions.
Sure.
If I'm sitting at home and I have a cough or fever, sore throat, or just don't feel well, and I would like to come over to the facility to be seen, are you saying that I can actually just jump in my car and come through the drive-through line?
Yeah, absolutely. And that's one thing that I am excited to announce to the public, that we are opening up this drive-through assessment clinic to patients without the need of a provider referral. You can, if you're concerned, definitely head on over to that location and start the process. The process itself is going to look a little bit like when you arrive, you will see several signs, cones helping guide you and your family through the assessment line. And you will arrive, you will see a sign that shows you a number in which you can text or call to begin the registration process. You never have to leave your car. If you are concerned about COVID, we are happy to see you in a drive-through line where, again, you're in your car the whole time. On the other hand, we still have Marietta Physicians Care Express, which is still open, and we are still seeing patients for other reasons as well. So if you are concerned and you have injuries, other issues going on, we are still seeing patients on the inside, and the drive-through assessment clinic is separate in that location.
So Dr. Hill, if I do jump into that line in my car and I'm coming through and I see all the signage, when it's my turn to be seen, am I going to be seen by a provider? And what will they be doing to me?
Yeah, absolutely. Great question. So you will be seen by a qualified healthcare professional that is very knowledgeable in these concerning times. So there's a lot of information flying at all of us with updates frequently. And our community doesn't always know which set of information is correct. So let us help you as the community, as patients, understand what's the most current, up-to-date recommendations related to COVID. We want to help guide you through that during that conversation. So you pull up underneath our tent, one of our healthcare providers will see you and then discuss whether or not you need to be tested at that time, and also have a packet of information for you. We will call you and follow up with you. We have several options to continue providing you with care, not just at that point of contact, but also afterwards too.
So one of your physicians or one of your advanced practice professionals will actually see me while I'm sitting in my vehicle and can actually listen to my heart, listen to my lungs if they need to?
You don't even have to get outside of your car. Our provider will see you while you're sitting in your car. They will be appropriately dressed in the personal protective equipment, or also known as PPE, as many of you I'm sure have heard. But yes, they will have the ability to examine you, listen to your heart and lungs, and then again perform testing if deemed necessary.
That's great. And I think that's a wonderful opportunity for all the patients and folks living in our community. So I'm glad that we're able to offer that. And it's important to, again, reiterate that we don't need to have a referral to come through this line.
Correct.
Or a physician's order. Now, I would like to go back to something else that you mentioned that I think is very important for the public. The sun is getting ready to shine a little more. We're entering that mid springtime area, kind of coming into that season. A lot of people like to get outside, and I know as an emergency physician, you see a lot of falls off bikes and arm pain, or maybe a cut here and there for a child. I heard you say that if I had something like that maybe wasn't respiratory related, that you're still able to see me there at that facility. Mm-hmm. So I could come to the facility for myself or my loved one, and there'd be signage of a place that I can park my vehicle and come inside.
Yep. The signs when you pull up in the vicinity of the Marietta Physicians Care Express will guide you as a patient. If you're concerned about COVID, we have signs directing you in a certain area. And then if you would like to be seen on the inside, there will be signs directing you as well. So again, we want to keep these separate, but in the same central location. We want to provide our patients concerned for COVID with a very safe environment, again, where you're in your car in the safety and comfort of your own vehicle, seen by a qualified healthcare professional, and also provide those other patients with other needs. As we do, we continue to have ongoing other issues, and that we want to provide a safe environment for those patients as well.
Dr. Hill, I really appreciate your time today. I do actually have another question. So if we are going to be seen there, as if I'm a person that either needs the assessment clinic or if I'm coming into the clinic for another ailment or injury or something like that, what time of day are you open? Are you still open the same times a day?
It's a great question. So we are still open from 8 a.m. to 8 p.m. every day of the week, 7 days a week.
That's wonderful. That's fantastic. Yeah. I really appreciate everybody's time today. Dr. Hill, do you have anything else you'd like to say?
I just want to reassure the community that during this pandemic, during these concerning times, we are here for you. We want to provide you with the most up-to-date information and care for you during these times, you and your family. So please trust us and allow us to give you that information and to help you with your current illness.
Well, thank you for that. Again, I appreciate everybody's time today. All of our information is available on our website, mhsystem.org. You can find a link for all the latest and greatest COVID-19 updates and information. I couldn't have said it any better myself, Dr. Hill. We are here for you as we have always been before this pandemic, and we will always be through the pandemic and into the future. We encourage you to receive your care during this time as you need it. You can still access our RN call line, which is staffed 24 hours a day, 7 days a week. Our Memorial Care Now app, as you all have heard me discuss before, is of course available for download on our website. And you can also contact your primary care physician, who do have options again to see you virtually through telehealth. Thank you again today for your time. We look forward to continuing these discussions in the future. And thank you, Dr. Hill.
Thank you.